when I spoke at the Senate the other day, and when I spoke during my confirmation for Cabinet Secretary for Health, I said the following. I said that as far as coronavirus is concerned, it is not a question of whether. It is not a question of if we are going to get a case in due course. It was a question of when. And members of the press and fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya. The case is a Kenya citizen who traveled back to Nairobi, returning from the United States of America via London, United Kingdom, on the 5th of March, 2020. She was confirmed positive by the National Influenza Center Laboratory at the National Public Health Laboratories of the Ministry of Health. There has been this misguided notion that if you have got a black skin, you cannot get coronavirus. I would like to disabuse that notion. The lady is an African like you and I. And by the way, she is 27 years old, just like you look like. I therefore urge all Kenyans to observe the following. Number one is to regularly and thoroughly wash your hands with soap and water or use alcohol-based hand sanitizers. Maintain a distance of at least 1 meter, about 5 feet, between yourself and anyone who is coughing or sneezing. Persons with a cough or sneeze should stay at home or keep a social distance, but avoid mixing with others in a crowd. Maintain good respiratory hygiene by covering your mouth and nose while coughing and sneezing with a handkerchief, tissue, or flexed elbow. Stay at home if you feel unwell with symptoms like fever, cough, and difficulties in breathing. We have suspended all public gatherings, meetings, religious crusades, games, and all events that are of a huge public nature. No more church services can go on, provided that they provide sanitizing and hand washing as people go into the worshiping areas. We have suspended all inter-school events, in other words, school-to-school athletics, school-to-school events, but the schools at this moment remain open. Public transport providers are directed to provide hand sanitizers for their clients and regular cleaning of their vehicles. Let me add here that this is something we arrived at in consultation with the public transport people. There was a meeting between the CS for transport. He's going to talk into that about matatus and so on. We are very pleased that they themselves say they are willing to do everything, including putting in their own money to ensure that people traveling in public transport are safe.